The next topic is a panel discussion about mental health in Sjögren's, time to stop ignoring it. Mental health is one of the most neglected and underexposed topics. Why is that, and what can we do about it? And is it still a taboo in 2025? I'd like to invite to the stage the licensed psychologist from Chicago, Illinois, in the US, Dr. Albert Friedman, and Georgios Michaelidis. He is a consultant psychiatrist and the director of the Center of Repetitive Transcranial Magnetic Stimulation and a clinical associate professor of the University of Nicosia. I'm pronouncing it wrong. I've heard it yesterday many times. And of course, our own Coralie Bouillon.
Sorry.
So, welcome everyone. Why is it important to talk about mental health? Can I start with you, Georgios?
So thank you for inviting me, and good morning to everyone. I think it's very important to talk about mental health, especially thinking about the stigma that is associated with mental health for a number of decades, and people not reaching for help because they feel stigmatized to be seen and being assessed by psychiatrists. It's actually very important to highlight that mental health disorders are very common, and very common as well in Sjögren syndrome. We can see high rates of depression and high rates of anxiety disorder. So if we do not treat mental health, perhaps our autoimmune disorders could be having exacerbated symptoms. As we know, stress can worsen the symptoms of any autoimmune disorder. So it's very important to highlight that reaching for help in time can improve the well-being of the person, the general health of the person, and mental health should not be left out as something from another planet, like an alien or something, which is part of the general health of the person. So I will be mentioning today some other innovative treatments as well that we could perhaps consider in Sjögren syndrome, in the essence that we all know that medications and antidepressants can worsen the symptoms of Sjögren. So what we know and what we have been using for nearly a decade, it's the brain stimulation, which is FDA-approved treatment for depression. Also, the magnetic peripheral stimulation that is also FDA-approved for chronic pain. So highlighting that there are other means to treat mental health disorders, so it's not just medications and it's not just psychotropic medications that could worsen the symptoms of Sjögren's, for example.
Dr. L., what are your thoughts about it?
Well, first, thank you. My name is Al from the United States of America. I'm a practicing psychologist, and I specialize in helping patients and families affected by rare disease through the United States and other countries too. I come to this work because of a personal experience. I had a son named Jack who was diagnosed 30 years ago with a different rare disease called SMA, a neuromuscular disease. And our baby Jack was diagnosed as a 6-month-old and given 1 year to live. Thankfully, he lived to the age of 26, and because of my experience as a parent and all of the stress and all of the trauma and all of the uncertainty and all of the complications that came with parenting my son, I turned my professional attention as a psychologist to helping other families affected by rare diseases. I'm grateful to all of you for inviting me and Patty here. It's a long way from home, but we're really happy we came. I've had the privilege of getting to know your community through some other work with our friend Maria from Trend Community, and got to know Coralie and Anna and your organization. And what I find coming here, and what I have found with many other rare disease patients, is that the challenges associated with, first, the disorientation. We go from having a life, a typical life, to having a diagnosis, and it turns our lives upside down. So it takes a lot of psychological reorientation to respond to the trauma. The life we thought we'd have isn't the life that's ahead of us. And second, Sjögren's, like many other rare diseases that I support, comes with a lot of uncertainty. It's impossible to know if you're going to have a good day or a bad day. And rare disease families, patients live with uncertainty every day. And it's very, very complicated to live that way. It's a hard way to live. And third, mental health and physical health I don't see as separate. There is no health without mental health. And it's important for us to take the time, and I'm grateful that you are taking the time today to talk about mental health, because most patients affected by rare disease, Sjögren's and others, and family members like me, we don't often have time to focus on mental health because we're preoccupied, understandably, with our physical health, with the medical symptoms. I'm a psychologist, and I can tell you that for 26 years taking care of my son, I didn't have time to talk about how I felt. I was trying to keep my boy alive. So it stands to reason that our attention to mental health, in addition to the stigma, societal stigma, and that's universal, I believe, also the practical realities of taking care of our physical and medical symptoms supersede our attention to mental health. It shouldn't. So often mental health lags behind. The pandemic shined a spotlight on mental health for the whole world, and what I'm seeing, and the reason I'm so busy, is that rare disease communities like yours are catching up now, as the world has caught up, paying more attention to mental health than we have before. So grateful to be here. And thanks for having me.
Thank you. Coralie?
And it's good to see you again. See you in person, Coralie.
Yeah, we know each other because I don't know if you all have seen our webinar on mental health a couple of months ago. We had this very open discussion with Anna, Al, and myself. No preparation, nearly no preparation, but I mean no slide, just a discussion. And we receive tons of messages from patients all over the world, I must say, because as Joyce said in introduction, it's a taboo. It's really a taboo. Still today, still in a rare or complex chronic disease, we feel it like a taboo. I won't share my story, but what I would like to share is exactly what you said. I had my diagnostic now 12 years ago, and I have never been asked how I was coping with my disease. Never.
No.
Never a professional, whatever professional I see, no one asked me right in the heart, how are you? How do you cope? Because I'm truly convinced that, and you said it as a professional, my disease, probably like any other disease, but it's not only a treatment, 3 pills in the morning. We don't have treatment, but we will have soon. It's not only that. I mean, my disease, it's my whole body with my mind and my physical symptoms. And I totally second your comment about stress that worsen every single symptoms. But today in 2025, as Sjögren patients, we are still need to fight to express that we are not depressed and we have some symptoms. We are depressed because we do have symptoms, burdensome symptoms, life burden symptoms, daily symptoms, every day, every single minute, even at night, we do have symptoms. So we have a huge gap to fill in mental health, in Sjögren's disease, and thank you both for your understanding of the disease. And I truly think that psychologists should be involved in the care of every single patient from diagnosis, because the delay of diagnosis is also a huge huge root of mental health being really altered. When you spend 10 years listening, your symptoms are in your head because you're a woman at 50, because you work too much, because you have young children and everything. Even when you have your diagnosis, when you go to see a doctor, you need to prove again and again. I mean, even myself, I never go to a consultation with the idea of proving my symptoms, MRI or whatever. And that's super complicating. It shows that I'm not healed with these 10 years saying it's in your head. And even now, with unmet needs, we have to prove our symptoms still today. And as I thanked Chiara earlier to show the broad range of symptoms, but we have the chance to have top high-level rheumatologists, but that's not the case for probably 90% of patients. And we need to support these patients because they come to their rheumatologist by saying, I've got that symptoms. No, it's not related to Sjögren. Take some antidepressant, it will be better. That's today, mental health in Sjögren's disease in 2025 in Europe. How also can we help these patients? How can we support these patients?
Having a condition that's invisible to the eye is complicated in a different way than having a condition like my son who used a wheelchair. Walking into this room, I would not have known anybody here has a rare disease looking at you. It's so hard for patients that I work with. And by the way, if you haven't seen the webinar that Coralie mentioned, I watched it myself to remind myself of what, it was such a powerful conversation. Essentially, Coralie and Anna conducted with me a therapy session that was made public. And took a lot of courage for Coralie and Anna to speak so personally about Sjögren. So I do a lot of work like that, podcasts and webinars, but that was a very special conversation. So I would encourage you to see it. But having an invisible condition and having people not believe you, even people in your own family sometimes question, is the condition real? Doctors who should know question whether the condition is real. Gavin yesterday, our keynote speaker, he did such a great job, and you had on your slide that the doctor said, go see a psychologist, right? So people ask me, the psychologist, all the time, is this normal, Dr. Al? Is it normal that I can't sleep at night, that I'm sad all the time, that I'm imagining something else bad's going to happen to me, that I've lost my confidence because people don't believe me? And the answer to the question is 99% of the time, whatever those symptoms are, yes, you're having a normal response. You're not crazy. You're having a normal response to a crazy situation. The circumstances we find ourselves in as patients and families affected by a rare disease can make people crazy, and navigating the healthcare system, regardless of what country we're in, can also make you crazy. So I found it very ironic, Gavin, to go see a psychologist on the slide. It's really hurtful to people. People are harmed and are hurt when they're not believed, when good, honest people are not believed. And unfortunately, that happens within our healthcare system, and it happens within some people's families. Anything like that?
Yes, I totally agree. And I think what is important to think as well is when we're looking at the high prevalence of depression and anxiety in the context of Sjögren syndrome, it's a syndrome at the end of the day, so it's a group of different symptoms that present with, and we should not be looking at mental health separately. I mean, mental health and physical health is health, and if we do actually have symptoms in the context of depression and anxiety, everything is kind of like interlinked together. We should not be looking at things separately, but we should be treating the patient that we have in front of us. And of course, individualized treatments should be offered and looking from different perspectives. And it's not just prescribing antidepressants, as often we tend to see this, not just from mental health professionals, by general practitioners a lot of the time, sometimes by rheumatologists as well. I think what is important is to evaluate each and every person that you have in front of you and look at things separately and differently, rather than just say, oh, okay, you have some depressive symptoms, just take an antidepressant. At the same time, as I mentioned earlier, thinking about the potential side effects that can exacerbate, for example, dryness, taking antidepressants. So we should be thinking as well, of course, psychotherapy and other treatments as well, like stimulation, brain stimulation, peripheral stimulation of nerves that can help these symptoms that the patient is faced. At the end of the day, we should not underestimate someone's symptoms because they just say, oh, I'm not feeling well, so maybe that's not just Sjögren's, it's something else. We should not separate it. We have in front of us one person. It's not that we have Sjögren's and something else. We have a person in front of us that we need to treat, and that's what ultimately we need to think about.
Yeah, I totally agree. I mean, we would like as patients that our mental health deserves the same attention as our immune system or the salivary gland. Just simple as that. But today, and I spoke, of course, with a lot of patients, and I feel it myself. When you say, I feel sad, I feel depressed, I can't manage, I just can't. It will be interpreted as a sign of weakness today. And I was really, when I had my diagnosis, I spoke with other patients. And a couple of them told me, oh, you go to see the rheumatologist, put a nice dress, put some makeup, wash your hair, otherwise he will think you're depressed and he will dismiss you. And I was like, okay, so you need to fake to be okay, to receive some care? I mean, where are we? But that was the truth. And of course, I'm not alone. All the patients during the webinar put in the chat, yeah, I do it also because 2 people told me that I was depressed and I was dismissed from the Sjögren diagnosis because of that. So how can we, because the main thing is to say it's okay not to be okay.
I think what's very important here is we need to educate not only the patients, we need to educate the health professionals. Unfortunately, it's been like this for decades, that people with mental health problems, they were not getting the appropriate help, even when they were actually reaching for help themselves. So we need to psychoeducate my colleagues, doctors, nurses, psychologists, psychiatrists, everyone, not to underestimate mental health issues. Because at the end of the day, if your mental health is not in a good shape, probably your Sjögren's is not going to be in a good shape. So we need to look at those things at the same time, not separately, not as a separate entity. It's true. We do hear comments from colleagues that are not appropriate. And even as a patient yourself, I will advise you to educate them. Tell them go to read about mental health problems. Tell them to go and educate themselves about how important mental health is, not just in context of autoimmune disorders, but in the general well-being of the person. And we need to continue this. We need to, day by day, give information to the public. And it's very important to have actually this topic discussed today, because it's mental health, as Albert said, there's no health without mental health, and that's what is true, really.
And how do you think you as psychologists and the specialists can work closer together? Because you just said, okay, the patient has to be there and say, okay, I want some help in mental health. But sometimes they feel so overwhelmed and just don't dare to ask questions to the specialists. So what can you do?
I think it's important, it was mentioned earlier in a previous discussion, that having multidisciplinary approach. So in each and every person, that in each and every clinic, that there is a rheumatologist, there should be a psychologist on site, not somewhere like 10 kilometers away. So, and they sit together once a week, they discuss the patients, they discuss their difficulties. So they look into the patient's perspectives and difficulties from holistic approach, not just from the medical approach that just you have these symptoms, take these meds, carry on with your life. At least the bare minimum is to have a psychologist on site to discuss issues, and potentially if there is the funding and if there is the money as well, to have a psychiatrist on site, the so-called liaison psychiatrists that work with organic issues that they can advise, they can offer appointments quite soon, I hope, and they can treat and offer to the appropriate specialists the help that someone needs. If we're not looking at things from the multidisciplinary approach, then we will be lost in gaps, as it was mentioned earlier.
Yeah.
I wholeheartedly agree. In the United States, some health systems have a multidisciplinary approach, but many sadly don't. And I assume other countries have the same challenge, or we wouldn't be talking about it. While the system is trying to catch up with this need, the other approach in terms of other colleagues in the United States that I'm seeing and that I'm involved with, one is starting next month, I'll be training other psychologists in the United States through a continuing education series of training modules on rare disease, because there are many psychologists in the United States, but very few of us who have an interest or an expertise in focusing on rare disease. And I'm very busy because there are very few of us who specialize in this as mental health professionals. So we're starting to train other colleagues on the unique needs of mental health patients. And the more that we can educate each other as professionals, the more help there'll be for other patients, for additional patients. The other approach that is taken quite often is there's strength in numbers. And although I greatly value the work that I'm able to do and privileged to do one-on-one in counseling therapy sessions with rare disease patients and families, I find there's strength in numbers. And I myself, as a dad, found as much, if not more, support from other families who faced the same challenges I did. And having support groups for Sjögrens, having support groups is a very powerful experience. I'm facilitating about 10 of these groups a month around the world with other rare diseases. And when you have 10 or 12 or 15 people on a Zoom from all different places, but who share a very rare experience in common that no one else has ever heard of, everybody's so hungry for connection. That's why you're here. That's why we're here. We're hungry to talk to other people who have such an unusual situation. So by having, I'm involved in training other professionals and training other professionals to help facilitate groups and volunteers who have the disease, training volunteers to facilitate support groups to support each other. Because what I see over and over again are patients and families lifting each other up and helping to strengthen their mental health by supporting each other. And mental health professionals like us can help encourage that and help support the people who are stepping in to do that work. There's just not enough of us for all the demand that there is.
Yeah, absolutely. A beautiful dream would be every single Sjögren patient diagnosed will be offered a visit with a psychologist. Just offering. Maybe the patient will say no for now. Maybe he will come back 1 year, maybe never, maybe every week. But at least give the patient the opportunity to have someone to exchange. It can be after the diagnosis, because after the diagnosis, usually you've got relief. Once you have your diagnosis, you've got relief. Oh, it's not in my hand. I knew I had something going wrong and I knew it. But as soon as you have the relief, you have the guilt to think that finally you're happy to be sick. And after the guilt, you have the uncertainty. You spoke about it, and the fear and everything. I mean, it should be mandatory to see a psychologist. And the support group also super important, and our National Patient Association are doing that in their own countries. That's a really important part because from my point of view, depression, anxiety, and so, but what I call emotional pain, starting with loneliness. Because when you're sick, when you've got a chronic illness, of course I can speak only about Sjögren, thankfully, you experience loneliness all the time because Sjögren is invisible. I mean, if a doctor comes in and see our patients and everyone, it will be super difficult to tell patient ill, this one not, this one yeah. So invisibility is super difficult for us. Even friends, family can find it hard to understand. That's a problem we have to deal with. And also another problem with social life. Because once you said no, people don't understand. And finally, from days to another day, the invitations fade, the relationships change, the look, the people change, and we start to withdraw. And isolation can slowly become a bigger burden than the physical symptoms themselves. It's like a vicious circle, you know, pain, depression, anxiety, more pain, more stress, more anxiety, more isolation, and finally we live alone. Because nobody understands what we are going through, except, and goes back to support group, the only people able to understand what we are going through really deeply are other Sjögren patients, honestly.
The most common problem I see amongst the clients that I support as a psychologist is isolation. Isolation. When you have a rare disease, it's called rare for a reason. It's not rare to us, it's rare to everybody else. And you as patients, we as family members feel different. And for me personally, the experience was like being launched into a twilight zone when our baby was diagnosed, like blasted off into outer space to a place that nobody else could even fathom. And it takes a lot of time to reorient to that twilight zone that you find yourself in, and you feel very, very alone and isolated until you get connected with others who share the experience of the twilight zone and or connected to professionals who can help you orient to this new world that you find yourselves in. It's very disconnecting to have a rare disease, and it's so important to be nourished by connection. This is true for all human beings, but it's especially true for people affected by rare disease. We all need to feel connection, and rare disease causes us to feel isolated.
Yeah, I think that's important as well, looking at things from biopsychosocial model. So looking at the biological aspect, the psychological aspect, and the social aspect of things. And sometimes where occupational therapies have a role here as well in terms of trying to help the person look into activities, look into what they're doing every day, and support them. And social networking and people and support groups are very important, because it's very true actually that no one really knows exactly what you're going through apart from someone who has the same problem with yourself, the same issues, the same difficulties. Of course, again, it's a spectrum and people experience things differently, and the pain and other things are very, very unique to the person who has these experiences. But sharing and feeling that you're not alone out there, that there are other people that they're actually facing the same or similar symptoms, it's empowering. It makes you feel that, you know, it's easier to fight something as a group. That's why there is a group of people here today than single or small groups. And looking at things from different perspective, more brains, more minds together, you can find solutions that can be supportive, helpful, and in the long run, long-lasting as well.
And speaking of solution, I have a question to you both. What tips could you give to a patient who don't necessarily can access a visit to the psychologist? and the patient tell you, okay, now it's enough. I can't fight anymore. I can't struggle. I'm too tired. I need to find the strength to stand up, to get up every morning, to go to work, to take care of the children, the family, the blah blah. What tips could you give to that patient? Except it's okay not to be okay, but patients are isolated. How can we empower the patient on mental health? How can we help them to
Yes. I think
that's
that's where technology has a role in 2025, and we talk about telepsychiatry, teletherapy, so people can access support through a video call, through video sessions. So sometimes if they live far away or they're isolated, they could just have support through Zoom meetings or Teams or any other form that people can get together even from their own home. But I will say as well, as part of the treatment is to try and get yourself out, try not to stay indoors for too long. They might not have enough energy, they might have fatigue and other symptoms. Sometimes it could be also in the context of depression. So if there is an underlying mental health issue that's not been treated, they should reach out. And we should take responsibility as well. Sometimes being a patient, we should take responsibility that I'm not well. I need to push myself up to where I can, up to the limits I can. Sometimes that might sound a bit funny what I'm going to say, or different. Being in a sick role, it's very challenging. Being in a sick role can sometimes psychologically affect us as well, that it's hard to get out of the sick role. We get used to the sick role psychologically, that sometimes unconsciously we might not want to get out of that sick role. Sometimes people being sick, they're looked after as well by family members, by other people, and it's not easy to leave that sick role. So we need to be aware of the trap of being in that sick role, and getting out of that comfort zone of being sick is not easy. It's very challenging. So we need to be consciously aware that we need to get out of that sick role, and we need to want to get out of that sick role.
I agree with all of that. And I would have said, if you had told me 5 years ago before the pandemic that I'd be practicing from home on a computer, I would have said it'll never work. The pandemic forced that on us. And now I don't have an office, and I'm able to see patients and families across the country and around the world through the computer, and it helps connect people. I agree with that. I'd like to add that the patients and families I work with who are able to sustain their mental health, who are affected by rare disease, don't allow the rare disease to become their identity. The people who are able to sustain their mental health are people who have facets of their lives that are alive outside of being a patient and their identity as a rare disease, a patient or family member. Work. When you get a diagnosis, you don't lose all of the knowledge you have. You don't lose all of the skills you have. You don't lose all of the wisdom and experience you have. You don't lose the relationships you have with people who care about you. So if you're able to nourish yourself by having an identity outside of the rare disease, it helps to balance out the very real challenges. I don't mean to minimize the very real challenges of the disease itself, but when we balance out the reality of the disease with other facets of our life, it helps to sustain us, helps to sustain the people that I work with. Getting outdoors makes a big difference. Being connected with other people rather than staying isolated makes a big difference. When people call me with complicated problems, you'd be surprised at how many of those problems are solved by 3 simple things: attention to sleep, attention to nutrition, and attention to exercise. And with Sjögren's, that might mean that if you're tired and fatigued, that you allow yourself to rest rather than push yourself. So listening to your body, for the patient to listen to their body and to nourish themselves in whatever ways they need, but to pay attention to those basics of sleep, food and exercise goes a long way as well.
I understood, and I think it's something every single patient should listen and should maybe read once a week. It's okay not to be okay, it's okay to rest. You don't have to prove, but women, sorry Gavin, and all the Lucio and the main patient, but women are often used to prove that they can manage everything with or without a disease. But something really interesting, you said something, of course I totally second, is that we don't minimize, but we're not reducing ourselves to the disease. Meaning that sometimes we, as patient partner, patient advocate, when we introduce ourselves, we say, I'm a Sjögren patient. But listening to you, I realize it's a mistake. We should say, I'm a patient living with Sjögren's, right? And maybe it's something that we need to think of when we introduce ourselves, and many patient partners in the room do the same because we are going quick and we are speaking fast and so. But that made me think that, yeah, it's maybe one thing that we need to promote and we need to talk about. We are not Sjögren patients. We are patients living with Sjögren's. So yeah, another really inspiring reflection.
Thank you. I think it's time to ask our members here to open the floor. No, we are going to open the floor for questions from the public. So, Susie.
Just a comment, rather. I want to stress the importance of what Dr. Michelidis said about stigma. It's very important, and it creates a lot of problems to patients. And they feel that they shouldn't have a mental disease, they should be okay, and that is wrong. And this is not the case. Many of us do suffer mentally, maybe at times. So I think what is important is to join forces, health professionals and physicians and patients, against stigma, and raise awareness that it is not a stigma to have a mental disease. It's perfectly all right, and you can get help and improve on that. This is what I wanted to stress.
Yes, having a medical condition is not a character flaw. It's a medical condition.
More questions?
Good morning, everyone. In Cyprus, the psychologists, the doctor might already know it, they don't even put their sign out of their office because the patients are not willing to go, and the other people know that they need a professional advice for their mental health. Imagine that, the stigma that people have, the taboo there is in Cyprus, especially because we're a small island, and things in small cities and villages are worse than in big cities with millions of people who no one knows anyone. Because in Cyprus, everyone knows everybody. It's even worse. And in waiting at the reception, where people wait, a lot of psychiatrists or psychologists put dividers in the room. So the patients don't meet each other. Even between them, they're afraid to know that this person has something bad. I'm here as he is here for the same reason. And we all need attention. And even that, I don't know if it's right or wrong, to tell you the truth, and this is my question. Is like the professionals support that behavior. I mean, when even the same professionals put the dividers in the room so the patients don't meet each other, is that helpful? I don't know, to tell you the truth. I'm not sure if it's helpful.
Okay, thank you for the question. Things are changing. I'm practicing in Cyprus for the last 10 years. I have clinics in Nicosia and Larnaca. It did happen to me that a patient from Nicosia wanted to come to see me in Larnaca because they don't want to see someone familiar in Nicosia and vice versa. Things are changing though, and I don't use dividers in the rooms. There are times that people want to come first in the clinic or last so they don't get to be seen. But we're here actually to fight for the stigma, not to support the stigma. Of course, in a matter of privacy, if someone wants to be in a private room and to wait there, we can try to facilitate it in terms of like personal data and in terms of like other means, but not to reinforce the stigma. And often I talk in different venues, on TV, on radio, trying to educate people that it's okay not to be okay, and it's okay to see a psychiatrist or a psychologist. Very clearly, more than 1 billion people around the world have mental health problems. More than one in four people will experience mental health problems. So I can start counting how many of us in this room have mental health problems, and there's nothing wrong with that. Even if we take into consideration dementias, we will think 1 in 2 people will have mental health problems at some point in their lives. So what are we doing actually? Are we playing hide and seek in this room or hide and seek in society? It's actually a big joke that we need to stop telling to our children, telling to other people, having mental health problems is as common as having a cup of tea or a cup of coffee this morning. So just get used to it and familiarize yourself with mental health.
When I did have an in-person office, the patients left through a different door than they came in. And I think that was intentional, and because in the small community, the smallish community where I was practicing, I saw a lot of adolescents. And this is one of the ways that the video therapy has been helpful, because the adolescent or the person that feels uncomfortable with the fact that they're going to get help doesn't have the risk as an adolescent of seeing their friend in the waiting room. So we're not, as professionals, trying to perpetuate a stigma. We're trying to honor the privacy of our patients and defer to their wishes, you know. And I think it's still a stigma in the United States, of course, maybe a little less so than prior to the pandemic. But we're all doing the best we can to honor the wishes of our patients and to support them. And better for them to come through one door and out another than to not come at all, in my experience.
Coralie, you want to add something?
Yeah, just a quick word as a conclusion. Thank you so much for your highlights. So yeah, I think it's time to stop ignoring mental health in Sjögren's, because healing is not about controlling symptoms. We have said it. It's about, and I feel it like that, restoring balance, meaning, and dignity, because mental health is also dignity. If I could leave another one message today, it would be, we can't change the fact that we live with Sjögren's, but we can change the way we talk about it. And that starts with recognizing that emotional and mental health issues just as real and deserve the care as physical pain. And I just want to add that we, patient association, patient partner, patient advocate, we can definitely be game changer in mental health. That's my feeling.
Thank you for the conclusions, Coralie. Thank you for the panelists. And just one small thing. I just saw that our dearest Katie has her birthday today. Happy birthday.